Hi there, folks. This is Dr. Ellenburg, the medical show here on Fox News Talk, 1020 AM, FM 95.5. Also find us online at foxnewskoan.com. That's foxnewskoan.com. Questions about your health today and medicine, that's what our topics are. Our phone number here at the station is 522-1020. That's 522-1020. Give me a call if you like. Talk to you about your health or talk to you about your medical questions as well. Again, some reminders during the week. How do you find when I'm not here on the radio on Mondays from 2 to 3 p.m.? You'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. That's Dr. Ellenburg with a U.com. Check us out. List of our services. Suggested sites for you to view to learn more about your health and things in the environment that affect your health. Such as reading material for you as well on our site. And also, as always, we do have a archive list of radio shows from the past you can download for free on MP3 devices. Again, that site is drellenburg.com. I do see patients in Kenai and Palmer monthly. And you can find out more about times and dates for those. Give us a call at the office at 563-2366. All right. Well, we've got a whole list of things to get through here today, or try and get through. And, of course, I can always take a break and listen to you about your questions about your health. Our number here, of course, is 522-1020. It's 522-1020. And something I'm going to do that we just done a long time ago is that, obviously, if you hear the show more than once or twice, you typically realize you're going to hear something about cancer on our show here. And the reason that is because cancer is a much more prevalent disease these days than it ever has been. And it's important to, if we can educate anybody out there or learn more in the process, things we can do to prevent it from happening, find things that can help treat it that are not already known, that information should be disseminated and talked about. And so from this point forward, I think we'll having pretty much a piece on each show talking about cancer information. And so with that said, we'll just dive right into things today. And so talking about cancer here. And I'm always a big proponent, and if you've heard the show enough times, hearing about what type of diets should we be eating if we have cancer? What type of diet should we be eating if we don't want to get cancer? And they're pretty much the same type of diet. And those are diets that are going to be low in sugar, okay? And there is a new study that came out that looked at the link between what's called a glycemic load. And that means the type of food you're eating, how much it's going to raise your glucose levels in your blood, also known as glycemic index of foods. And for over years, there have been websites and listings of foods that this one's has a higher glycemic index rating than this one does. And so those have been used to help people sometimes try and figure out what type of diet they should be on. And this particular study was done in colon cancer patients and appeared in the Journal of the National Cancer Institute. And as we know, one of the big areas of change that needs to happen, anybody who has cancer, are lifestyle changes. And a big one, typically for most patients, is going to be dietary approach. And, what has been known and been never talked about that much over the years is what type of diet should we be avoiding, what type of diet should we be on, so we don't increase more tumors if we have cancer or increase the risk of developing cancer. And with this study, looked at 1,000 patients who had stage 3 colon cancer. That means they had cancer that had gone outside the colon in their bodies, and they reported their dietary intake during a period of 6 months. And these patients also were receiving chemotherapy at the same time as well. And they looked at a variety of factors and came up and said basically is that patients that have higher levels of glycemic index, glycemic load in their diet, and total carbohydrate intake increase, carbohydrates are increased in their diet, were linked with an increased risk of cancer recurrence and death, and the survival of the patients as well. That meant they lived longer if they had a better diet, with a lower glycemic index in this case. Again, we can kind of distill that down to the common statement saying a diet low in sugar. And what we've known for some time, and I love this quote, I'm going to read it verbatim from these two docs. So in the accompanying editorial, Dr. Neil Meropal and Nathan Berger, both of the Division of Hematology and Oncology at University Hospitals of Case Medical Center and Case Western Reserve University in Cleveland, note that these clinical findings in the study we just talked about are consistent with an observation more than 50 years ago that cancer cells are avid sugar consumers. Cancer cells are avid sugar consumers. And really we should say tumor cells, but that's the way it was quoted in this article. So here you're talking about information that's 50 years old, not the study itself, but this comment that we've known this long that patients who have cancer should not be eating a diet high in sugar, right? And that's why it's all the more important that we I'm in the medical world, of course, folks, and when I see patients who have cancer, I always want to talk to them about their diet because a lot of times it hasn't been mentioned. A lot of times it's been mentioned, don't worry about your cancer. We're going to work on that here with, chemotherapy or radiation or surgery. We'll take care of that. You just go about your business. Don't worry about it. It'll be fine. Well, that's not a bad way of doing things, trying to allay the fear of the patient, tell them we're going to help them out. Those are all good things, but what we're doing disservices is not recommending some type of a dietary approach. If we know that tumors eat sugar, then why not recommend a diet low in sugar? That should be like advice that's handed out after someone's diagnosed with cancer. Here is your dietary approach, low sugar, right? It should be happening. And it's been known for so long that we even have a test that's used in medicine called a PET scan or positron emission tomography that uses a radioactive glucose that's injected into the patient, and then they are scanned with typically a CAT scan, and then they get a PET scan. And the radioactive glucose is going to go to areas in the body where there's a high metabolic rate. In tumors, in most people unless it's liver cancer, different story, but in most other cancers, there's a high turnover rate of different types of tumors. So like in breast cancer, for example, or in colon cancer, brain cancer, and brain cancer as well. So there's many, many cancers all operate the same fashion. Those tumor cells want to eat sugar. And so when the patient's given this PET scan, then it goes there and it lights up on the scan for the radiologist to determine, okay, well, this uptake of the radioactive glucose by these tumor cells in these areas is abnormal. Okay? It's a way of diagnosing further tumors inside patients who have metastatic cancer. So we've known this for some time, and yet we still don't recommend frequently, very often, hardly at all, what type of diet for patients to not be doing and what type of diet they should be doing. And again, low sugar is a take-home message. And I mean to be redundant here because it's important to understand that. It's an important piece of the problem, okay? And, it's not uncommon when we find more cancer occurring in patients who have diabetes because they're patients who have trouble controlling their blood sugar. You have more of a fuel source around for tumors. You have more opportunity for them to grow, get bigger, and to occur in people. So a low sugar diet. And that can go well for all kinds of other conditions. Low sugar diet for what? Diabetes. Low sugar diet for cardiovascular disease. Low sugar diet for inflammatory disorders. Right? Autoimmune diseases. Low sugar diet, probably a good idea. We know that a fair amount of diets that are high in sugar tend to suppress certain parts of our immune system function in our body. They're harder on our ability for our organs to help control our levels of blood sugar and cause further disease. But it's a note to bring home for sure in cancer patients. And so in this particular study, again, a reminder in stage 3 colon cancer patients, those who had a diet lower in the glycemic index of foods fared better as far as the overall time of survival, their less occurrence of disease, or increase in size of tumors. And again, that study appeared in the Journal of the National Cancer Institute this month. All right, folks, returning today is Dr. Michael Ellenburg. It's our medical show here on Fox News Talk, 1020 AM. We're also find us 95.5 FM. Our phone number here at the station is 522-1020. It's 522-1020. Also find us online and listen online at foxnewskoan.com. That's foxnewskoan.com. All right, we'll continue on the road here with a few more cancer information here for our cancer section of our show here. We're doing pretty much every week. And there was a great article that appeared. Where did that appear? In the International IMNG. So IMNG Medical Media. I'm not finding the exact quote from the journal article here, but that's fine. Talking about ginseng. And there's one thing, if you heard last week on the show, we talked about caffeine content of certain beverages that are out there that exist on the market as far as these sports drinks or, Pep-Yip type drinks. And Red Bull was mentioned specifically. And in Red Bull actually do find ginseng and caffeine. And we also see there's a lot of products over the counter you can buy even at a convenience store saying, take this and it'll boost you up in the next 5 minutes. typically a lot of ginseng is added to those type of products. And it's a type of ginseng. There are different types. So you have American ginseng, you've got Korean ginseng, you have Siberian ginseng. That's some of the very main ones that are found out there. And Siberian ginseng has been around for some time and is a great type of herb to be used. People who have poor adrenal function. It's been used by the Russians in several hundred different studies in athletes over the years, and even in chronic immune system diseases. And it can be used in a variety of ways. And in this country, we have something called American ginseng. And a new study that appeared looking at using American ginseng and reducing fatigue among patients with different types of cancers. And here we go. And it was presented at the annual meeting of the American Society for Clinical Oncology. And certainly one of the biggest things that I see in cancer patients that come to see us for supportive care is that fatigue is probably one of the biggest complaints that most patients have. And a lot of times that's basically due to the fact that they're receiving chemotherapy, which is an unfortunate toxic process in the body. And it also has a tendency to frequently decrease the ability for people's bone marrow to make red blood cells, which will cause anemia and make you feel tired as well. If you have less red blood cells floating around in your body, you have less hemoglobin that's going to bind on to oxygen and be inside red blood cells to deliver oxygen to your tissues. If you have less oxygen, you're going to feel more fatigued. You're going to feel tired. And so fatigue is a very common thing. And in this particular study, they looked at fatigue that could not be accounted for other reasons. People were anemic who were receiving chemotherapy in this particular study, and they looked at the use of American ginseng. Now, American ginseng is kind of rare in a sense. I believe the ability to grow it takes a while, so there's not a lot of it around. It tends to be expensive. And one common article that's worth noting is that they do suggest that, if you're tired, just don't go take ginseng. I mean, if you don't have cancer, you're taking ginseng for fatigue, maybe you should be checked out by your provider to see why are you tired, okay, instead of just treating the symptom. But in this study, they looked at different dosings for patients. People were taking anywhere from 750 milligrams to 2,000 milligrams a day or 2 grams a day for a period of 8 weeks. And they were using a powdered extract of 4-year-old Wisconsin ginseng root. Even told us where it came from. That's interesting. And they noticed, and patients were evaluated on a certain type of different scales, basically rating their fatigue level from 0 to 10, 10 being the worst, 0 being the least for fatigue. And a total of 175 patients completed the trial. Many of those patients who dropped out, unfortunately, had stage 3 or stage 4 disease, where they would need probably more than just American ginseng to keep their fatigue levels at bay and get relief. So it looks like American ginseng could be a better use in people who have stage 1 or stage 2 type cancers. And it worked quite well in most of these people. And again, a reminder that, this is not something to just go out and take on its own. You want to be seeing a provider. If you have cancer and you're experiencing fatigue, talk to your provider about it. See if there's reasons of why we have fatigue that are may or not being addressed, and get those addressed. And certainly considering taking something like American ginseng could be a wonderful thing for fatigue. It's really also good for your adrenals, like most ginseng species are really good for your adrenals. And when you're receiving chemotherapy, your body is under a fair amount of stress, just in general, beyond the fact of what stress you have in your own life. And American ginseng can be a wonderful soothing and supportive herb for adrenal function in those who are experiencing cancer, or even those with other chronic type disease conditions, such as asthma patients, for example. We could also talk about any type of chronic disease conditions such as Crohn's disease or also colitis. Ginseng doesn't tend to be much of an anti-inflammatory at times, but it does help support your adrenals, which are some very good anti-inflammatory organs in you that could be beneficial in inflammatory disorders like osteoarthritis, for example, or rheumatoid arthritis. Ginseng may have a place in that. I don't have any direct research to state that and prove that, but it makes sense why it could be helpful in using that. Siberian ginseng is getting a name change these days. This is not American ginseng, but Siberian ginseng. My favorite herbs for patients in their adrenal function, and they're calling it Eleuthero. And the Latin name for Siberian ginseng is Eleutherococcus synthecosus. But Eleuthero is a nice short word, and they're trying to take away this use of ginseng being used in so many things, in sports drinks and a variety of things, and really downplaying how well and useful an herb it really can be for a disease and promoting health, rather than having it in some type of a drink just to pep you up for a few hours. But to consider American ginseng in those who have fatigue involved in cancer treatment. All right, folks. Again, this is Dr. Michael Ellenburg. Questions about your health, questions about our show, questions about medicine as the main topic here, of course. Our phone number here is 522-1020. It's 522-1020. One last comment today on the cancer piece is just a reminder that there are different things that can actually cause cancer. You know, a lot of times we'll say, well, what causes cancer? We're going to find the magic bullet that causes cancer, and then all cancer will be gone forever. Well, it's not. It's so much more complicated than that. That probably is not going to happen. But what's also we don't talk a lot about is that there are certain types of viruses that actually can increase your risk of developing cancers. And there's an article that appeared in the British Medical Journal of this month looking at liver cancer patients and seeing less liver cancer overall in the study in patients who were receiving antiviral therapy who had hepatitis C. So it's hepatitis A, B, C. There's even a D and an E these days they've discovered as well. There's even an F and a G, different subtypes. But in hepatitis C, antiviral therapy is used very frequently. In this particular study, they saw a reduction in how often patients who were receiving hepatitis C antiviral therapy and a reduction in the occurrence of liver cancer in these patients, because hepatitis C and hepatitis B as well can increase your risk of developing liver cancer. And so Oral Season 2 for me is talking again about different viruses that cause or can cause cancers. Like, for example, lymphoma. It can be Hodgkin's lymphoma, even non-Hodgkin's lymphoma. And Epstein-Barr virus has been linked with non-Hodgkin's lymphoma for sure, and lymphomas in general in patients. And Epstein-Barr virus is very common. It's the monovirus. And even though you may have had it in your youth and cleared it, or you've never had it, you might actually have Epstein-Barr virus on board, but exhibit no symptoms. Okay? There's another one. About 5 years ago, I forget the type of viruses they found, but they when they biopsied lung cancer cells out of a certain number of patients, they found viral components within the tumors themselves. There's even a rare type of brain cancer that now has a virus linked to possibly causing it. So we don't talk much about this in medicine in general, in the public, in saying that certain types of disease conditions can increase risk of developing cancer, but they certainly can. And you always hear me mention a lot about diabetes because it means you have poor sugar control, and we know that tumor cells are avid sugar consumers. That makes sense. But the virus piece, why would somebody who has a virus on board have an increased risk, if a chronic virus on board that has increased risk of developing cancer? And that's because you're in a sense putting a monkey on the back of the immune system, in this case being a virus. And if your body is chronically trying to fight and rid itself of a virus or viruses, its surveillance and means of detecting aberrant cells, such as tumor cells, might be diminished, and probably is diminished in its ability to do such things. And it's an important part, and definitely anybody who's had lymphoma and been treated and you're now better, I think part of the remission approach and part of keeping it from coming back ever again is be screened for things we actually can screen for that are viral things that can cause disease in the body. Get that ruled out or ruled in as a possibility. If you rule it in, get treated to clear these viruses from your system. And that can be even hard to do with some of these things. Epstein-Barr virus is very hard to kill, and many would say, well, you'll get better and you'll clear it. Well, you see people suffer from Epstein-Barr virus for years. Even though it's not in the sense of it being measurable on a lab test, it's still in them. They've had it before. And you can see that with certain types of immune system testing that can be done with Epstein-Barr virus. But clearing these viruses is very important in long-term health for a lot of patients. And it's kind of the wave in the sense of the future coming down the road as our means of detecting viruses and bacteria that are infecting humans chronically over a period of time. I think there'll be a massive research area to learn more about as to what these things we haven't detected before. What are new viruses? What are new bacteria we haven't really discovered that may be causing disease that we're totally unaware of? We can even liken looking more at viruses, talking about cardiovascular disease. There's been discussions over the years about different types of bugs, viruses, bacteria, even funguses that might increase your risk of developing cardiovascular disease, such as having a heart attack or having a hardening of your arteries. So the picture is much more muddier than it seems to be. And it's not clear, that's for sure, as these different types of conditions that can arise because we have different infections on board that we can't identify. So it's a reminder that there's much, much, much more to be learned about what causes cancer and other type of chronic disease conditions in humans than we know right now. Much more, a long ways to go, and hope we'll find more as we go along. But I just think it's important to kind of put that out there as something to understand about viruses and their effect on health. We have a caller on line 1. Sandra, are you there?
Yes.
Sandra, excuse me.
Yes, thank you. I've really been learning a lot from your program. You're talking about causes of cancer here in the Epstein-Barr.
Mm-hmm.
I have had it in the past, and the last time I had it, he said I was still possibly a carrier. Is there some way to determine whether you're still carrying it?
Well, there is an Epstein-Barr or EBV panel, or Epstein virus panel that can be done. It's a standard panel done through big companies like Quest or LabCorp, for example, and they look at different immune complexes. And so in our body, we have what we've figured out at this point in time is that we have different immune complexes that can be looked at, and they have odd names like IgG or IgM. And when someone does an Epstein-Barr virus panel currently in medicine, if they have any IgM complexes present at enough level that's measured in their blood, we would say, it's positive, so they have a current infection. Okay. Now, IgG can show up in many people like yourself, Sandra, who were either had it or were carriers. And pretty much once you've had it, you're always going to be a carrier. Now, the part that I've seen interesting is actually in the quantitative part of these lab tests. And this is a little technical, but it's important to understand this. And so it'll come back with a value. Say you're positive, say you're above 1. And we've seen patients who have values that are even 30 or 40 or 50. And what we're still hearing from the providers who screen them saying, well, this is an old infection. That's not a current infection. Well, I think that there's some limitations in our abilities to interpret and to actually elaborate what that means. And these patients I'm talking about that we've treated over the years, they'll have fatigue. They've got night sweats. They're not in good health. And even though their Epstein-Barr virus panel says they have no current infection, they only have a past infection, based on their immune complex rating. And I guess where the problem lies is that we haven't developed some better tests to say, what about patients that seem to have active disease, but yet the lab test says they're not active? And, again, it's limitation in our ability to diagnose things laboratory-wise at times. And this is one of those areas. And we've had good success in numerous patients who come in, and if they haven't had this Epstein-Barr virus panel done in a while, we'll have them redo another one and see what the levels are actually like. I've even seen people down at, say, 3s and 4s, for example, which is pretty low, that are still positive for a past infection, yet they have current symptoms that would indicate their body is fighting something.
The symptoms would be more than just being tired.
Well, tired's one of them. That's a big one. So fatigue's a big one. A lot of times they'll have some type of sweating episodes that are not hot flashes. They're literally they're almost like a night sweat. And when that commonly occurs in a lot of patients, even beyond the viral, we see more commonly in people who have viral problems, that's your body's attempt to increase your temperature to kill off the virus directly. We'll also see things in their lab work. For example, another piece of lab work, a complete blood count, or CBC, breaks down white blood cell count into 5 different types, and at times we'll see a shift where they have an increased neutrophils and decreased lymphocytes that can, even though the white blood cell count may not be elevated, another sign of things too. So those are some of the small things we'll see, but put together as a totality and then based on the patient's history, we'll decide to treatment or not to treatment in these patients. And antivirals out there are not very effective for this. So there's different alternative therapies that could be used to treat that patient's immune system.
So, through nutritional therapy and things.
Nutritional therapies and things like ultraviolet blood radiation. Hold on for the break and I'll address this. We have to go to commercial break right now, Sandra.
Thank you.
All right, thank you. We're back in a few minutes, folks. Hi there, folks. It's Dr. Ellenburg. Welcome back from our break there. Houston today, it's Dr. Ellenburg here on Fox News 1020 AM, 95.5 FM. Questions about your health, give us a call here at 522-1020. It's 522-1020. This is Dr. Ellenburg. The lines are open for your questions about your health. Getting back for the break there, we were talking with Sandra about Epstein-Barr virus, and I was talking about one of the hardest things in doing in treating Epstein-Barr virus that's chronic in patients. And it can be debatable on as far as the diagnosis of this, is if they have symptoms, if they're having like night sweats and chronic fatigue and are tired and worn out, and there can't be any explanation for it, and then we have an Epstein-Barr virus panel drawn on these patients and their past exposure, or IgG complex, as different subfractions of that are elevated, we would suggest you need to do some type of treatment. And like I said before, there's very things out there that actually help that. And she mentioned the word nutritional therapies. And yes, that's certainly a direction to go towards, and specifically talking about things like intravenous therapies, for example. People can do IV vitamin C, for example, can be used for a variety of things. We discussed on the show over the years the use of that in helping out cancer patients. But it's also going to be a valuable tool in treating things like hepatitis C and treating things like Epstein-Barr virus. And hepatitis C isn't so much you get rid of the actual hepatitis C itself, but knock down enough of the virus to give the patient some better health to deal with it and help the immune system out. So IV vitamin C, there's a very novel therapy called ultraviolet blood irradiation, or UBI. The best site online to learn more about this is www.doctors, DRS for short, so DRSU, B as in Bob, UBI.com, DRSUBI.com. Check that out. It's been used as a treatment for a variety of infections. We're in our 83rd year in this country of being in use and around. Developed in 1928. It's a very interesting therapy that uses a portion of the patient's blood exposure to UV light, and the blood is infused back to that patient for treatment. It actually uses your blood to treat yourself. Pretty interesting stuff. And there is research on that exists, again, at drsubi.com. Check that out. And, it's beyond doing any IV therapies for people with Epstein-Barr virus, the EBV, it's chronic. There are a variety of things to take orally as far as, olive leaf extract, vitamin A, all kinds of different types of antivirals that could be beneficial. Of course, it's called find the right folks to figure out what those things are going to be or how they might actually help you. So, but all is for naught. And definitely consider that, again, Epstein-Barr virus does increase your risk of developing lymphoma, a type of cancer. So get it checked out. Okay, well, the second part of our show today, we're going to discuss a few different areas, memory, heart disease. We're going to talk about the gastrointestinal tract and what are some good things you can do for your GI tract to have good gastrointestinal health. And then from there, we'll see how much further we get. I got a lot of topics we can get to today, but we'll at least get into those. And again, if you have questions or comments about our topics here in medicine or questions about your health, our number is 522-1020. That's 522-1020. Okay, well, let's get going here on part 2 of today's show. So, memory and boosting brain power, an interesting article that appeared in Natural News, listing out different things, and I'm going to add some things into this article that I think could be helpful. And one area that they bring up, which is worth talking about, is, of course, stress. And we do know that chronic stress can affect our body in a multitude of ways. And yes, it can affect your memory and your brain power. And, chronic stress affects the body in a variety of ways. In this article here from naturalnews.com, they do bring up the fact that cortisol, they call it the stress hormone. Well, it's not just cortisol. We also have what's called norepinephrine and epinephrine that are also found in your adrenals that are released when you're under stress. Old names for those are adrenal and noradrenaline. But the cortisol and epinephrine, norepinephrine, if they're released enough into your system, puts your body under a lot of stress. If we have a fair amount of epinephrine, norepinephrine in our bodies, more often than not, we're constricting our arteries, in general, increasing our chances of developing, or developing for sure, high blood pressure in patients. If cortisol is secreted at high levels because someone's under stress a lot, we can develop insomnia. We can start having issues with losing weight. It can affect our joints as far as decreasing our ability to have good anti-inflammatory processes in our body. So it can affect us in a variety of ways. And also, of course, chronic stress can put a big whammy on your gastrointestinal tract. Many people under chronic stress or who are in situations that are stressful and don't voice their concerns about their health, they can't get those things out because they're more of a, say, introverted type of individual, they'll tend to internalize their stress and ends up affecting their gastrointestinal tract. And I was talking with somebody recently about this, that, neurotransmitters in your brain are also, almost all of those are found inside your gastrointestinal tract. So same neurotransmitters in your brain are found in your GI tract. So that gut feeling is a real thing. And for those who internalize a lot of stress and have no outlets for it, you can develop, direct gastrointestinal problems with that. And the part that's important to understand about stress, and I'm sure there's more areas to it, but a simple way of talking about it is, how do you reduce stress in your life? And many people aren't even attempting to reduce stress because they may not see it as a stress, because this is how things are. I have no way out of it. That's just how it is, and if I'm under stress, so be it. Well, and that's the attitude of, well, it is what it is. I'm just going to deal with it. So there's one method, right? Just deal with the stress the way that it is and see what happens. 2, is, for many, very hard to do, is getting away from that stress. Literally getting away from what's causing that person to be stressed, different events that are causing that problem. But when you're married to somebody who stresses you out, or you have a job you don't like, or it's your child, you can't really just dump those things and move on. So what becomes important is reframing how you experience the stress. And how do you start with that? Well, you start by actually acknowledging that there is stress in your life. There are things that you're doing. Like I have, and me frequently getting this attitude of where I'm like in a hurry, just like gotta go, right? And let's sit back and take a deep breath, breathe, drop my shoulders, and just relax for a minute. Why am I in a hurry? Well, sometimes I'm late somewhere, but that's not very often. So more or less, it's just the way I operate in general is moving quickly. I talk fast, so I try and keep that from happening here on the show, although it happens at times, I'm sure. As listeners know, that I will speak fast and mumble some words through, but is slowing ourselves down or realizing what in our life actually causes us stress. And maybe with some of those stresses, there's ways to mitigate it. There's ways to lessen it if you only become aware with it, because your body is only resilient for so long to take such stresses. And being a naturopathic doctor, I'm in a group of providers where we see a lot of patients who come in to us as a last resort for some type of health condition that they've been going through, or they have problems, but whoever they've seen, they say there's nothing wrong with me, but something's wrong. I'm not anemic. I don't have thyroid disease. I don't, but I'm having trouble sleeping, and I'm having trouble with my breathing at times. People are having anxiety. People are stressed out. And it's trying to make yourself aware of what those things, be aware of it. And that's one thing that you can be very proactive in your own health for, is being more aware of what your body's doing. Don't ignore your body. And we're not taught this anywhere. They don't teach this in school, not in high school, that's for sure, or grade school. They don't teach it in college either. You might learn it in some program. You might learn it because you have high blood pressure, and somebody said go for some meditative work, or go find ways of reducing stress that don't require drugs, for example. But stress is a killer. And I mentioned, I think earlier part of this year, in February, there was a cancer conference I'm starting to go to again that's kind of an integrative, every type of practitioner there type of cancer conference. And it was interesting that, I would say 2/3, if not 3/4 of all the presenters, who are all medical doctors, by the way, presenting, every one of them, somewhere in the talk, had a section on stress and how it affects people, how it affects people's immune systems. And, I mentioned the word cancer again, but it can be other type of disease conditions. And so we have to address that and how we look at things. And, getting back to changing stress requires perspective and making changes in your habits. And you have to do it. It's something you may be forced to do it when your body starts to wear out, right? Then what are you going to do? And bring this back around, as stress affects people's memory and they'll be able to boost their brain power and learning, it becomes a question of, well, if I reduce my stress, now what can I do to actually help out my brain directly, And one area that I have a lot of interest in is because I have a mother who suffers from it, it's Alzheimer's. Now, remember we mentioned here a few weeks ago, Alzheimer's is a type of dementia. Dementia is not Alzheimer's. That means if you have these 3 or 4 conditions that can be dementia, that's a category. Under that category, a bulk of dementia patients have Alzheimer's. Okay? And what can we do to try and prevent that? There's been numerous articles out there, and usually it's a question of prevention versus treatment. Because once somebody has fairly advanced dementia or Alzheimer's, it's very hard to make changes for that person. Their brain has got enough damage going on in it that's hard to even correct it at that point in time. But I want to mention a few things that we're talking about, and a couple of those. One is fish oil is a wonderful supplement that can be very helpful for brain health, and not just in people who have dementia or have this early memory loss. But your brain is made up mostly fat. In fact, some of the top 2 types of fat in the brain are known as EPA and DHA, which are omega-3 fatty acids. And we can supplement those through supplementation or through our diet. And, of course, they're high in fish. They're somewhat high, the precursors are somewhat high in flaxseed oil or flaxseed meal, but getting good levels in may require taking fish oil, which requires taking a supplement that has high amounts of DHA and EPA in them. and could require even a couple of grams a day, if not more than that, in some patients to change that. I mean, there's been a great book I mentioned over the years that I read probably about 6 years ago, 7 years ago now, called The Omega-3 Connection by Dr. Andrew Stoll, who used fish oil supplementation in patients with mild to moderate depression and even in bipolar patients with success. A few products I do want to mention that are worth noting. One is called Prevagen. Prevagen has been on the market for about almost 4 or 5 years. It is an extract of jellyfish known as aquavorin. And the Prevagen has got quite a bit of research behind it in a variety of different trials. And the bottom line is it looks at an area in our brain and our body called the calcium binding proteins that have been shown that with age they decrease in the body. And that the jellyfish extract from the product known as Prevagen can increase levels of that in people's bloodstreams and hopefully help with early memory loss. And we've seen improvements with that actually in patients. Another type of good supplementation is acetyl L-carnitine. Now, there's L-carnitine by itself. This one is acetyl L-carnitine. Has shown to help mild to moderate early memory loss and even depression and even pain in a number of patients as well. Lithium orotate. Lithium carbonate has been used for quite some time to treat bipolar patients at very high doses, usually anywhere from 1 to 2 grams a day in some people, which is pretty high up there. Lithium orotate is a type of lithium that's used in extremely small doses, like 5 milligrams, 10 milligrams, and is actually available over the counter. And it's been shown to help out memory loss in patients. We're not quite sure how it works, but it can. One of those things where we've seen it help, but we don't have an exact definition. Dr. Jonathan Wright has used it for years, I know, with himself and his patients, and he has suggested that lithium orotate actually can help detoxify the brain. And that makes a lot of sense if that actually does that. But there's some helpful things to consider for supporting your brain health as well. And obviously on top of all these things is getting proper rest and sleep. Sleep, without a doubt, affects every system in your body, and without it, you will not be in optimal health. That's for sure. Okay, folks, just a reminder here, this is Dr. Michael Ellenburg. It's our medical show here on Fox News Talk 1020 AM. We're also on 95.5 FM. You also find us online. You can live stream us online at foxnewskoan.com. That's foxnewskoan.com. Questions or comments about your health, give me a call here today. We still got about a good 10 minutes left in today's show. Our phone number here is 522-1020. It's 522-1020. Well, a reminder that when winter comes, we need to become or stay active. There was a study that was done recently at the American Heart Association's annual scientific sessions of this month that said 1 in every 4 deaths every year in the U.S. is attributed to a heart-related issue. That means 25% of all deaths in the U.S. are related in some form or fashion to our heart. And in this particular study, they're looking at whether the weather is a factor in death. Is the weather involved? And looked at places such as L.A. County, Texas, Arizona, Georgia, Washington State, Pennsylvania, Massachusetts. Didn't look in Alaska or Hawaii, of course, but those places they checked out. And what they found is that in all the areas, which is very interesting, so in all those areas, not just in areas where it's, got winter or it's sunny the whole year or whatnot, most places it's not, by the way, but it says in all areas, circulatory deaths rose on, having a circulatory disorder such as fatal heart attacks, heart failure, heart in the arteries, or a stroke. Death from those conditions rose an average of 26 to 36% from the summer low to the winter peak over a period of 4 years. And what they were saying with the study that we find interesting is that they suggested that climate was thought to be pretty much a determinant of why we would have variation in certain types of conditions in death rates over certain times of the year. But it wasn't for all those things. But the biggest thing they demonstrated is that even in a warmer climate is that even with the approach of winter in a place where, say, it's sunny most of the time, people are doing less things outside. People are being less active. And they definitely is going to affect your health. And I would certainly argue that, in Alaska, this being seen is definitely a case where I think the climate would make a big deal, where people have less exercise in the winter. And I've been hearing it for years because part of my intake and seeing a new patient with whatever kind of condition they have going on is, do you exercise? And I always hear, well, in the summer I'm real active for a couple of months, in the winter I slack off. I was, well, we see it quite a bit, but the reality is you don't want to slack off at all in the winter. Especially as a time you want to be quite active because it'll help you better deal with the light issues if you have trouble with light in Alaska in the winter and being dark. And it'll further help in decrease occurrences of depression and anxiety, keeps cancer away. It's good for stress. It's good for a number of things. Is maintain exercise activity in the winter. I think that means driving over to the mall, walking around the mall. You just got to pay for the gas to get over there. So don't buy anything in the mall. Because I hear like, well, I don't want to belong to a gym. I don't like walking, the streets are slick. Go walk indoors. Walk around a big mall. They are here in Anchorage area. That certainly exists, and it can be done. So we want to keep our activity up in the winter. We don't want to decrease it and do less. That's not what we want to be doing. And then furthermore, with the exposure of sun exposure, I would say that we probably have more, and I see this frequently. I mean, in the winter, if you're in Alaska, when do you see more colds in Alaska? In the winter. We're more indoors. We're less outside. We're around each other more often. And we're also being exposed to no vitamin D from the sun whatsoever in the middle of the winter. Zero. We know vitamin D affects the immune system. So all those things kind of come together to help affect what kind of diseases you're going to develop, what type of colds or flus you might going to get. But staying active in the winter is an important factor in decreasing not just heart-related deaths from this particular article we're talking about, but just helping maintain your health overall, is maintaining your activity levels in the winter versus the summer instead of having to decrease down to a very, very small level. So stay active. Stay active in the winter. That's the point of the article was today. Okay, let's get into talking a little bit about what are some good methods for creating a healthy GI tract. Again, some reminders. We have about 7 minutes left in today's show. If you have questions about your health, now's a good time to call 522-1020, 522-1020. I'm going to kind of work my way through this article here in different places. So maintain a healthy GI tract. Well, why would you even want to do that in the first place? Why, and maybe this sounds like a dumb question to ask, but no. You want to maintain a very healthy GI tract because your GI tract is involved in how you assimilate food into your body. It's involved in how you eliminate eliminate waste from your body. It's involved in your immune system function. We just talked today how it's connected directly to your brain, so it's also enhanced and affected by stress in our lives and the healthy GI tract. So your GI tract is a basis, and without it, you will not have optimal health. You'll have health problems of some type if your GI tract is not healthy. So how to keep a healthy GI tract? Well, one, decrease stress, and we discussed that quite a bit here recently, so we'll stay away from that topic and not go back to that, but decrease stress, number one. Number two, what are some foods that do wonderful things for your gastrointestinal tract? Well, one big area is fermented foods, which is not really a common area for most Americans to want to eat fermented foods, such as things like sauerkraut, or kefir, which can be made from water or from dairy or even goat milk, for example. Kombucha tea is a type of fermented drink. Different vegetables, pickled vegetables like pickles, for example. Cabbage, which of course is sauerkraut, but you can pickle these things too. Pickled different vegetables could be helpful as well, like Brussels sprouts. Cauliflower. Pickled cauliflower is good for your gastrointestinal tract. There are different types of fermented forms of soy products, such as miso, like miso soup, or nattokinase, tofu, that contain bacteria that are actually very good for your gastrointestinal tract. And what these foods contain are natural bacteria that's in the fermentation process of making them has been created and can help add to the intestinal environment, the milieu with inside you. It's an environment of its own, by adding healthy bacteria to that, and that kind of helps stimulate the system of the gastrointestinal tract to grow and kind of foster healthy bacteria in the gastrointestinal tract. Is where probiotics come in. Healthy bacteria you can take from a supplementation or a liquid product with different types of probiotics, different types of bacteria that are known to be found in humans at good levels in healthy gastrointestinal tracts. So fermented foods, big area. Glutamine, not talked about enough. The amino acid glutamine is probably one of the best nutrients, amino acids that is, for helping repair people's GI tracts. And one thing that we see in a lot of patients that's being discussed these days, actually in a more mainstream context that hasn't been discussed before, is talking about the term leaky gut syndrome. Leaky gut syndrome, where you basically have a breakdown in your intestinal walls, and you start having food in a sense that's broken down, but could have broken down further, crossing over in very, very, very small, tiny particles into your gastrointestinal tract, into your blood supply, where your immune system becomes involved. And this is part of discussing how people have things like, psoriasis, or develop a lot of different joint pain problems that could be traced back to actual food allergies. This is real stuff, and we're actually starting to finally see that the specialists, like the gastroenterologists, actually are using the terms leaky gut syndrome. It's been proven to be a real thing. And the way to think about it is, if you think about putting bricks together end on end, and say that's the inside of your gastrointestinal, say those are the cells inside your GI tract, and those bricks have a nice tight fit on the end. Nothing gets through them, but maybe they're porous, and that's how the food's digested gets through the porous part of those bricks, the porous part of your cells in your GI tract. But when damage happens in your GI tract, those bricks, in a sense, shrink. Those cells shrink up and now develop little gaps in that intestinal wall where things can get through that before couldn't get through because there were no gap junctions. There was no place for them to squeeze through. And once they get in your bloodstream, it can begin an immune reaction that can cause all kinds of problems. This is why we'll frequently see people who have, say, rheumatoid arthritis, if they get on a diet that's low, that has no gluten in it. I'd say a third of patients on a gluten-free diet who have arthritis tend to have great improvement in their arthritis by not eating gluten because they have allergy to it, and it's harming their gastrointestinal tract, and that's allowing things to pass through in their bloodstream that normally would not pass through their bloodstream, and causing inflammation in their body. And inflammation, of course, is key in many different types of chronic health conditions. But glutamine can help keep those walls strong on your GI tract. L-glutamine is an amino acid. It's very inexpensive and can be taken in fairly high amounts at times too to help repair and strengthen your gastrointestinal wall. So if you're having those sort of health conditions, that can be approached and using glutamine to help repair and make a strong, healthy GI tract. And that's kind of the thing is, how do we make a good GI tract? One is taking good fermented foods on board. Maybe consider even using probiotics. And then doing things, if you have any damage to your GI tract, to help repair it. And how do you know if you have damage to your GI tract? Other than the fact that you might have blood in your stool, which is pretty dramatic. Maybe you have gas. Maybe you have bloating. Maybe you have eczema or psoriasis. That would indicate that that person probably has some damage that's taken place in your gastrointestinal tract and needs some healing to take place in there to heal things up. Get those junctions nice and tight again so nothing can get through them. All right, folks, there's a sign that things are going to a close here today. I thank you for your calls, and thank you for listening today as well. We'll be back next Monday, of course, 2-3 p.m. here on 1020 AM, 95.5 FM. During the week, you can find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. That's DR and Ellenburg with a U. Have a great week, and we'll talk to you next Monday. All new directions must go everywhere. Big round people in a cool little square. Or you can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family.